tell you that we're at a very serious point, not just in Providence, but overall in our hospitals, with the number of patients that we have in our hospitals that are COVID positive. As Dr. Velasquez said, the Delta variant is much more contagious than what we saw earlier. For every one person who is infected, they can infect 6 others. And think about that. That's very staggering when you think about small groups and large groups and the possibility for further spread of this. That's just how contagious this is. Here at Providence right now, we have 150 patients at Sacred Heart and Holy Family that are COVID positive. That's the most we've had. You know, it's not a record that we wanted to break, but we have broken that. Many of these are in our ICUs, and everybody that is in the Sacred Heart and Holy Family ICU now on a ventilator is not vaccinated. This is a preventable disease. And we also know that once on a ventilator, the mortality or the risk of dying is very high, approaching 50 to 60%. And this is a preventable disease. So I just implore you to follow Dr. Velasquez's suggestions about masking, but vaccination as well. To show you how serious this is in our organizations, we are halting elective procedures. We had reduced procedures prior. We are halting elective procedures going forward because we are continuing to have an influx of patients coming into our emergency rooms and demand for ICU beds to be extraordinary. So that would mean elective heart caths, that would mean endoscopies, that would mean elective bypass grafts. So this is more than just impacting people with COVID. This is impacting the health of our communities. Healthcare is a limited resource, and some of our caregivers have been exposed and have COVID as well. We are part of this community and we need your help. Our nurses and doctors are exhausted, and imagine caring for 750 dying over the last 18 months. That's equivalent to 5 737 plane crashes just in Spokane County alone, to give you some perspective on this. I'd like to share my experience with you in seeing COVID patients and what it's like for them in the hospital. For those patients not yet on a ventilator, they're gasping. They can't get a full breath. They have to sit up to breathe and lean forward. They're exhausted from trying to breathe. They can't sleep because they can't breathe. It is misery. For those that are on a ventilator, they're given medicine to keep them sedated. They're turned every few hours from their back to their bellies to try to keep their lungs more healthy and to help them heal. The age group that we're seeing in the hospital is mostly between 40 and 50 years old, much younger than what we saw previously. And so we have an ask from you. We know that you appreciate our nurses and doctors. You've called them superheroes, but they aren't feeling like superheroes right now because they've seen so much death over this long period of time. We're asking you to put political views aside and to stand by your nurses and doctors and your healthcare systems in solidarity by masking in public, by avoiding large crowds. Masking does work. It holds those respiratory droplets that transmit the disease, so it will decrease the spread. We have a lot of super spreader events going on right now, and I know people are looking for fun and a break and all those things, but be cautious in your choices there. There's fair and there's a football and there's other gatherings, probably weddings. Please be cautious in your choice. If you do choose to go to an event, indoors or outdoors, please mask. And also, the vaccines are safe. Pfizer is FDA approved and it's gone through rigorous testing to get that approval. So we're asking you to help take care of us, take care of others by masking and getting vaccinated. Thank you.